What's up, you guys? My name is Miguel, here to give you your daily dose of radiation. Today's video, we are covering the main differences between working night shift and day shift as an X-ray tech at a Trauma 3 ER. So to give you context, I've been doing this for 4 years, night shift, and apparently I do an ungodly amount of overtime according to everyone I'm at work, because I dabble in both teams and I'm willing to pay the price and dabble whichever slot is available to pick up the money. So I have a good amount of base knowledge on both teams. So the main difference I've noticed is during the daytime, you have the in-house, well, in our hospital, we have the in-house radiologist, all the supervisors. The ER has slightly higher influx of patients, and you deal more with the floor residents and doctors a little bit more often, and they'll be calling a lot of more calls to deal with during the daytime. Pay, once again, unless you work the afternoon, the 12s, and the shift diffs, you'll just get base pay. Most places during the daytime, they will have more techs on site during the daytime. Like mine can run 4 to 5 during the day, and nighttime we have 2. So there's just a constant little flux of work that happens, usually just split up. Some will go to the floor, some will hold down the ER, and they'll kind of circle in between, or whatever's going on. If you get called up to do like an emergency exam on the floor or something stat or code, you'll kind of flux and it'll vary. During the nighttime, just because there's only 2 of us, we usually stay in the ER for the most part. And then if we get called upstairs for a stat or rapid or like an NICU, certain floors have higher priority. Usually number 1 is always the ER, and then if someone calls from rapid response or someone's coding or something like that. But sometimes they'll call us to want us to do certain exams, and it'll just be something routine. In the nighttime, you have the beloved morning portable list that spawns in between 12 to 1 a.m. depending on where you work. And that's like a set of list of exams, usually chest x-ray, some KUBs, of exams that the residents or doctors put in that they want to see when they come in. Between 5 all the way to 8 a.m. they'll kind of come in. That's a little bit different dynamic, because you're responsible as the night shift to do that before the day shift comes in at 7 or 8, depending on what time you want to knock out all that work. That's the most amount of kind of random, like you're not sure what the amount of workload that will come in. During daytime, that does not exist. Obviously, you'll have certain exams that will spawn in, and they'll be the morning ports for us, and you'll get a glimpse when you come. Like I'll clock in right now, and I can see like a little bit of the work list. But once again, depending on the add-ons and stuff you'll have. Most of the time, the day crew gets all the like celebrations or all the what is called, like whatever the hospital's doing. Nighttime, we usually don't get none of that. Comes like you'll have a grace period of like 12 hours, right? You either work 12 in the day, 12 in the night. Majority of the time, during the daytime, you just go through little cycles of like you'll knock out a certain amount of stuff, and then you'll stop, and then you knock out more, and then you stop for a little bit. During the nighttime, between like the 2 and 5 a.m., it kind of calms down, and the ER and everything kind of slows down, and you have a chance to kind of relax or kind of take care of any of the morning ports, depending how it is. Usually the daytime doesn't get that. I never worked in the daytime and that's happened. So I would highly recommend anyone working night shift. More money, less problems sometimes. But you do have the occasional stuff goes offline and updates, and if you don't know how to deal with that, then you're kind of in a sticky situation. So it's been your boy Miguel. See you on the next one.